Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today is a Friday Get 'em Up Out of Town version show, and what a weekend we have in store for us here in Pittsburgh. It is Super Bowl weekend. Hardly there would be a person that wouldn't be aware of that. How you intend to spend it with your family and friends and so forth, I'm sure you're already planned where it is you're going to be. I know where I'm going to be. I hope we win this one and take another ring home and look forward to just an excellent Sunday evening. Well, we are with you today. We're going to allow you to come on in. Actually, this is the last one in a long time of allowing you to come on in because starting with next week, we're going to be having guests each and every show. And so the open phone component that we've allowed for the last two shows and today, we'll have to wait a little bit before we bring it back. Anyway, that being said, the calendar goes something like this, folks. On Monday, Roland Thomas returns. Now, he caused quite a bit of controversy when he was initially with us. I know many of you, because you called up to mention it, you went and got the book, The Genius Within, talking about bioengineered, not genetically modified. I get that thing straight. I guess there was some confusion out there. Bioengineered algae, 4 types of the more than 25, I think I'm right about that, 25,000 species. There are 4 that appear to have the most nutritive dense of all other forms of algae, coming from a area in Siberia, which is fed by a certain water supply that allows these algae to grow there freely. Anyway, Roland has agreed to come back. I promised I would bring him back when he was last with us. That was on January 17th. He now returns to talk about this entire issue of algae, bioengineered algae, and the genius within. I'm hoping that today I get supposed to be getting a bunch of information from Roland. Now, it's coming from Canada, so who knows? But I talked to him on Tuesday, and I'm hoping that I get it today. Because if I don't get it, then I won't have any advanced preparation. I'll just be going in there blind, which is okay. Certainly done it before. But nonetheless, I hope I get, I think the DVD's coming, the book is coming. Allow me to look over those things. Monday, you'll want to be with us for Roland Thomas. Then on Friday, next week, Jerry Singleton is going to be here. Now, Jerry was in my office yesterday. I'm going to talk a bit about that as our show goes on today. Administering to the first group of patients, my select group of patients that are doing ECP in my office. There were a total of 13 MCG tests that were given yesterday. All the reports were available before he left, after having been sent via a computer and internet to a processing area in New York. Anyway, we're going to talk a bit about that today in terms of the MCG testing. I believe it is the most interesting and fascinating study, non-invasive, no problem. You lie on a table for, once the test gets going, it takes 7 minutes to do it. They put the leads on the ankles and the wrists, and then 1 V lead on the chest, and 7 minutes later the test is over. But boy, what information you can get. We'll have Jerry Singleton, who represents ProLogic, the company who markets this type of device in our Western Pennsylvania area. And as it stands right now, folks, we're it. I claim that this thing is going to start to be seen in a lot of places. A lot of docs are going to get this. They should. Your local doctor, your PCP, and your cardiologist both are going to be armed with this test, but they don't have them right now. This is too brand new. We're going to be talking about the test itself, what it means, how it's done, with Jerry on the 11th, which is next Friday. By the way, if missed on Wednesday's show, don't forget we have Dr. Susan Smith-Jones, who comes with us to talk about natural remedies for libido boosting. She said for bear on this one, folks. Talk to her. She has emailed me a couple of messages already on the subject, and let's just say she's not going to do a cursory job here. She is taking this one on. You'll not want to miss our hour with her on Wednesday, which she claims is a Valentine's Day gift for all of you. On the 16th, on Wednesday, Doug Inglesby returns. He and his family are deeply entrenched in the supplement world since its inception. High-potency vitamins were literally invented by his father. He now has carried on that work, the family work, and his company is something that he speaks a lot about. We're going to be talking about the flavor makers, talking about the pharmaceutical industries making, I guess, something tastes very good, which could really have a lot of harm to you. Then on 18th, he comes back. I'm talking about Jerry Singleton. We've got 2 weeks back-to-back. He's here on the 11th talking about the MCG testing. Then he comes back on the 18th. And now on the 24th, I'm going to encourage anybody out there who would like to get this study done. You're allowed to call up. I had the initial run with in-house patients. I just wanted to get comfortable with it. I learned a couple things that I'm glad that I did a group of homegrown patients first. But nonetheless, give us a call if you'd like to have this done, completely insurance covered, and it will give you information, well, that when you hear these shows with Jerry on the 11th and the 18th, will just not be obtainable anyplace else without having a full-blown cardiac catheterization. Now, who in the heck wants one of those? But without having one, this electronic study will be able to give us the same, how about that, the same information as if one had cardiac catheterization, but never moved toward the cath lab at all. Very interesting, is it not? On the 21st, Alan Ridgway returns to our airways with us. He's the diabetes man. He has all sorts of products for the diabetic. If you are a diabetic, if you know a diabetic, you'll want to have him dial up. Just for the diabetic shoes alone, Alan fits custom-made shoes to diabetics. Their insurance covers the cost of these rather expensive shoes, and they are entitled, meaning the patient's entitled, to get 1 pair of these orthopedically custom-made designed shoes annually. So he'll be talking about the shoes. He'll be talking about other implements and devices and materials that the diabetic utilizes, and there always is a new generation of electronics that comes into play. We'll learn from Alan what's the hottest thing on the agenda for all diabetics, and that'll be on the 21st. 23rd, Kurt Domkowski comes here talking about RTD dressings. It's related to diabetes in this way. The diabetic has a terrible time with wounds, peripherally infected wounds, in the areas of the feet and the hands are the most subject to developing a kind of infection that literally, because of the poor blood supply in the diabetic, usually moves them along a pathway of developing a very large infection, a gangrenous condition, and unfortunately, all too frequently, a amputation of the varying degrees. First they start at the ankle, and then below the knee, and then above. It's a mess. Anyway, there's a dressing, RTD dressing, that all diabetics should want to pay attention to. I think everybody, not just the diabetic, should want to have RTD dressings in their medicine cabinet, because it literally is able to suck all of the microbes out of a wound and be retained within the dressing itself, which you then discard. So that's on the 23rd. Then once again on the 24th, here in the office, all of you out there who want to take me up on my offer to have MCG, which is multifunctional cardiogram. I got a problem with that term. I was talking to Jerry about this yesterday. His company needs better marketing. I don't think that MCG is descriptive enough. But be that as it may, for right now, we'll call MCG the kind of testing you'll want to give us a call at 724-942-3002 in order to get yourself scheduled. Pick a slot throughout the day, starting at 9 and going until 4 throughout the entire day, a slot of time that works best for you. We'll be waiting for you. And like I say, the entire test should take about 15 minutes. That's from the time you walk in to the time you leave. We got a little behind yesterday because, it turns out this machinery is so sensitive to interferences. It took us a while to get the hang of that. But once the test begins, it is 7 minutes. It's computerized and it's over. Okay. That's how it stacks up right now. We do have another guest for the 28th. I'm waiting to get his information so I can talk more about it, and I'll probably be able to do that for you on Monday. Now, have you seen the light talking about the miraculous form of ionic trace minerals put out by a company called Trace Mineral Research? We now carry the signature line of this product. It is without a doubt an area that I think we have let you down in the past. I mentioned it. I think you can't have a supplemental regime going on unless you are replacing not only your macro minerals, things like calcium and magnesium and manganese and things like that, where you require such a large part of it that the multiple vitamin actually doesn't do such a bad job at all with including those. But when it comes to the traces, 72 trace elements found in the product put out by the Trace Mineral Research Company that comes from the Dead Sea in Utah. These are trace elements that you can't get any other place. You might be able to get some in salt, sea salt, that certainly does have trace elements, but they aren't as ionic. They aren't as dissociable as the liquid and even as the tablets would be. So please give us a call. I would also ask you to hit the website, traceminerals.com. Traceminerals.com will allow you to look at the video. I say, once you see the light, there's a video utilizing an electrical connection and showing how the addition of 1 drop of this substance put into a solution causes electricity to flow in a way that you'll just never forget it. Also, those of you who have pH concerns, and I have patients that keep coming to me concerned about their pH, looking to try to swing things toward the alkaline, and I think I've pretty much determined it. Unless you are using ionic trace minerals, you really don't have a shot. It is just too difficult to get your pH to swing in the alkaline range. But when you see the experiment done either at traceminerals.com or we have the DVDs here in the office. If you want one, give us a call. We'll send you one out. Or you can come on in and I'll let you just see. I'll use my computer and let you just see it if you don't have a computer at home. Once you see these little experiments, it's something that you do not forget. And so, we'll let it go hit that. All right, let's take a short break. When we come back, I'm going to re-mention, I think, something really important, especially to my listeners out there, the Vitamin C Advisory. I'm bringing it to your attention, folks, because there's a problem out there. The FDA has shut down the only manufacturer of non-corn-derived intravenous vitamin C. The company's called McGuff. I'll talk to you about that when we return. The Vitamin C Advisory issue next up.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Right here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Friday Get 'em Up, out-of-town version of the show where you can call in and take over, set the agenda. Anything on your mind is okay with me. The number to do that, I think you already know it, but just write it down again, 412-825-6262. That's 412-825-6262. Give it a call. I'll hear a knock on the door, and I'll let you in the store. Be pretty easy. Now, I brought this to your attention on Wednesday. I'm bringing it to your attention today. I probably won't have the opportunity to reinitiate a conversation of this type for a number of shows, not because we're going to be having guests, but while I had the ability today, I wanted to impress upon you something's going on out there, especially listeners of mine, patients of mine, people who understand the vitamin C controversy pretty well. I think that as you have come to rely on me, I'm the one that brought to you the idea, the fact that vitamin C, unless it's from a non-corn derived source, which 99.9% of all vitamin C comes from corn, and 100% of all corn is genetically modified. So without getting into the nitty-gritty of that, just to know that it's all genetically modified and that it is a biological dud is something that all of my listeners and certainly my patients do well and they know very well. Now, what happened here is at the end of 2010, we had a company, the only manufacturer of IV vitamin C in the country. And I actually think it might be in the world, although I can't say that for sure. But I can say for sure in the country, a company called McGuff. It supplies all of us doctors with a number of supplies, but it was the staple of the sources, the only source that we could know and get and obtain easily IV vitamin C from a non-corn derived source. Well, that is until the FDA shut them down. And that's exactly what happened. And literally overnight, one day we had full access, and the next day the FDA said, you cease and desist. You no longer are able to distribute this. I don't care how much you have in your warehouse. It's over. And I don't know, and no one seems to be able to tell me how long this is going to go on. The reason I bring it to your attention is I want you, as I normally do, I want you to be so savvy and so aware of potentially what can go on out there, okay? Your doctors, and it would have to be a medical doctor, an osteopathic physician, or a medical doctor, who use IV vitamin C, more than likely, well, if they were using IV vitamin C, and if it was, as it should have always been, non-corn derived, then the only manufacturer you could ever get that material from was the McGuff Company, meaning that it all dried up, that there is no longer a source for your doctors to be able to obtain this manufactured product from McGuff. What there are out there and available, so difficult are they to find, are compounding pharmacists that we're able to get some raw, either beet-derived or tapioca-derived forms of vitamin C, which do have a biological bang. The difference is that unlike a company like McGuff, that when they had a run of making a batch of vitamin C that was non-corn derived, they made 10,000 bottles a day, and they stacked it to the ceiling in whatever warehouse they were putting it in. The compounding pharmacist cannot do that. At most, you'll find that they can handle maybe making 100 bottles a day, and that just will not be able to keep up with the demand out there that McGuff was filling. What this means is, I think you need to check. You need to make certain. Ask to see the bottle with respect to any IV vitamin C that you are having used on your behalf. I think it's safe to say that if you are using oral forms of non-corn derived vitamin C, that I don't believe that source has been affected in any way, shape, or form. It's only intravenous forms of vitamin C that the FDA shut down. So if you've got a good source for your vitamin C that's non-corn derived, I think you won't see any interruption in the ability to obtain that product. But they're just completely shut down. There is no longer a source for the non-corn derived vitamin C that's to be administered IV, unless you were able to find a compounding pharmacist that could get the raw product. Difficult to find, folks. Absolutely difficult to find. Now, how would you know what you have, what your doctor has? I think you do a couple things. One, you ask to see the bottle. If the bottle is amber and it has the term McGuff on it, then you were lucky enough to be going to a doctor who's got a pretty large supply of this stuff and hasn't run out yet. The unfortunate thing is that he or she will run out. And if the bottle changes from a amber color to a clear color, you need to be checking some other things. But as to whether or not it's a McGuff product, they are not allowed to distribute anymore. If you have a supply, if you had a reserve in the office and you were utilizing it to administer IV vitamin C, as so many of we doctors do, to help out a whole host of problems, you need to be on guard. You need to be on the lookout for a possible embarrassing situation, to say the least. Now, if you see the bottle and it's of one of these new sources of non-corn derived vitamin C, the complexion of that bottle is going to be completely different. Number one, the bottle is going to be clear, not amber. Number two, the bottle is going to be huge compared to the McGuff formulation because vacuum bottles are being used, and each bottle contains 50 mL of the non-corn derived form of vitamin C, but they have to use vacuum bottles that have a large suction as soon as they penetrate it with a needle, and so therefore you'll find that the bottle is much larger than the previous bottles were. So it is clear, number one. Number two, it is larger. Number three, the actual vitamin C, you're going to note, because you never could see it before, the vitamin C was in an amber bottle. You never actually saw the color of the stuff. The color of vitamin C actually has a slight yellow tinge to it, and that's okay. But you'll be able to see that in this clear bottled stuff. Next, you are not allowed, if you are a compounding pharmacist, which is the only people now who are able, if they have a supply of non-corn derived vitamin C, they have the supply, you are not allowed to manufacture a compounded product without the name of a patient appearing on the product. So although it's not fair to say that it should have your name on it, because it might be that an entire source of the vitamin C is being used for multiple patients, but there better be a name on that, or it's against the rules and regulations of the FDA and is suspect. And it also should say right on the bottle the type of source that it is either beet-derived vitamin C or it is tapioca-derived, and then you'll know that your doctor was lucky enough to get a source that enables them to keep up with the demand and provide you with the special kind of care that you need with respect to getting this stuff intravenously. So, oral vitamin C, not affected. IV vitamin C, absolutely infected. Check out your doctors. Make sure they show you the bottle. Make sure that if it's a McGuff bottle, that's fine. They just had a large supply of them before the cease and desist order was circulated. They're going to run out unless they got a huge order. I don't think many of us do, but they will run out. And then at some point, keep asking to see that bottle. I really don't know. I don't think the company of McGuff really knows when all this is going to come to an end. And if it is going to come to an end, I got this terrible feeling that the FDA just loves the fact that they've got the McGuff company under their thumb. And they're squirming, talking about the McGuff company, and until they let up pressure, it doesn't get resolved. And how long it will take before they finally do get it resolved is so nebulous that we shouldn't speculate on it. At the moment the McGuff company does get it resolved, I'll be sure to let you know about that fact so that you can be looking for the amber bottles again. You won't have to find that they're large bottles at all. It's stamped right on the bottle and it's non-corn derived. In the case of McGuff, they were using tapioca. In the case of my suppliers nowadays, they're using beet, but it's usually one of those two. So we were able to establish a relationship between ourselves and a compounding pharmacist that can meet our demands. 100 bottles a clip is something that we easily can use up. We could never be using, thousands of bottles in a clip, so they're going to be able to keep up with the demand of their customers, and you need to keep up with the awareness so that you are the super informed consumer that you need to be. All right, enough of the vitamin C advisory. Let's take a short break. Hey, look, testing is always a big thing that we're into around here. Every time I search the blogosphere, I usually find something that's very interesting. Guess what? Came across a blog item yesterday called 7 tests that can save your life. We'll be talking about those 7 tests in a moment. How many of these tests have you had? Have you ever heard of them before? Let's talk about them when we return. 7 tests that can save your life. Be back in a moment.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard on this Friday morning, get 'em up, out of town version of the show. Out of town for sure. Hey, Super Bowl weekend this weekend. Get ready and just spend it with family and friends and have an enjoyable evening on Sunday night. And leading up to Sunday night, we're going to allow you to participate in setting the mood and the topic here at the show. 412-825-6262 is the number to do that. That's 412-825-6262. Anybody who'd like to come on in and give a knock, I'll let them right in the store and we'll find out what's on their mind. In the meantime, waiting for that knock, I got another issue I'll bring to you. This one, I'm always on the computer. I'm always looking into the blogosphere, and something caught my eye just yesterday. Don't even remember whether it was MSN or whether it was USA Today, but each one of these websites has a very extensive section on health, and so I'm always moving through these various areas, and this one caught my eye. I first read it, and it actually said 7 tests that can save your life. Well, you should know me by now. I really think that I would know what the 7 tests are, and I would be saying to myself, I sure as heck better be doing them. You all have come to expect that I'm going to tell you what the best tests are to know as much about you as possible. And let's just see now if what was envisioned to be the topic in that article. By the way, the article appeared and is written by the editors of Prevention magazine. So that's pretty much a non-controversial site. They are well known and they are well established. And when I first read the byline, 7 tests that can save your life, that interested me enough. Well, then I clicked on that, and what came up interested me even more. You'll see what I mean. Because the real article was called 7 tests, and now this new phrase, that you are not getting that can save your life. And that little phrase there, that you are not getting, I really got intrigued then. I said, I got to know what these 7 tests are. So you who out there, and I know you take notes, and I know you carry those little pieces of paper into your doctor's office, and I already told you I'd love to be a fly on the wall when you are demanding of your primary care physician that he orders certain tests for you. Many of you have them already tamed. They just go, oh, it's him or her again. And they go, what? They go, what did you find out this time? What are you going to bug me about? And so that hasn't deterred you. You continue to become enlightened on these very issues. And so, hey, 7 tests. Let's find out what Prevention Magazine thought were the 7 tests, and then a little paraphrase there, that you are not getting that can save your life. Test number 1, and you'll see when I get done with all 7, I'm going to bring in what I think to be the way to make certain that all these are getting done without any form of invasiveness whatsoever. Because the first test that they say, talking about the Prevention Magazine folks, that one should be getting is getting a cardiac calcium score. Now this is called a cardiac CT scan. I do not like CT scans. I think the radiation exposure from a CT scan is way too much. I never have liked them, and you have never heard me really make a case for why I think you should go get one. So I'm not going to hold Prevention Magazine to a standard that I can appreciate that they don't have. Nonetheless, a cardiac calcium score is nothing more than a score given after they take enough pictures through that CT scan to rate how much calcium you have deposited within the lining of your coronary arteries. If you have a score of 0, well, then you have 0 risk. If you have a score of greater than 400, then they say that your risk is very high. They also say if you have a score of 1,000, there's a 25% chance of you having a heart attack within the next year. So that information correlates rather well. I wouldn't want people to have a cardiac scan. You're going to find out that there's a way to get around all that in a moment, but at least the Prevention Magazine folks felt strongly enough about this that they put it as number 1 on their list. Okay, number 2. Carotid intima test, otherwise known as ultrasound of the neck. This is a study we do every single time our cardiologist comes here, brings his staff. These are called Dopplers. These are completely non-invasive, and they do give us a pretty good idea of what the rate of occlusion is in arteries that come close to the surface of the skin. They're not just shot off of putting that probe over the neck. They're also used in the groin, and they're also used behind the knee, because these are 3 areas in the body where the artery does come close to the surface of the skin, and by using Doppler devices, you can get that valuable information with respect to how much disease you have in your non-coronary arteries. And then the idea was to extrapolate, well, if you have 80% occlusion in your carotids, the likelihood is you at least have 80% in your coronaries, but you can't really say that for sure. Nonetheless, it's the test that's number 2. I think is a wonderful test. It is non-invasive, and we do them all the time here. You want to ask for them yourself. Number 3, how about this one? Prevention Magazine says you want to get a test that they call the Inflammation Finder. And my dear listeners, you already know what the Inflammation Finder is. I think you, in a pop quiz, would be able to identify the fact that a CRP, a C-reactive protein, and by the way, an HSCRP, which is heart-specific C-reactive protein, is the best way to determine what your inflammation factors are. Are you getting this test done by requesting that it be done from your doctor? If you're not, you take the little pieces of paper in, drive them crazy, and demand it, because it's such a simple test to perform. The information is so valuable. We're always looking for scores to be in the decimal ranges. I will tell you that I've seen them all over the board. If I get a score of somebody that has a CRP, an HSCRP of 5, 10, 15, 20, 25, and 30, the higher they get, they literally present to me as somebody who would be on fire and have to be doused. So as easy as it is to order that test, you make sure you're demanding to have that test done. Next, I thought this was interesting because they say that another test of the 7 would be advanced lipid profile as well as a lipoprotein little a. Well, now here we go. We've been talking about this for well over a year now. We've always talked about lipoprotein little a. This is a very precarious form of LDL, the most dangerous forms of LDL that they are. But besides getting the standard lipid panel, which consists of cholesterol level, triglyceride, HDL, and LDL, you have to ask for 2 other measurements that, if not asked for specifically, are not going to get done. One is you want to know your lipoprotein little a level. The normals go up to around 33. If you're anywhere near the elevation of around 33, you've got a problem, folks. You need to deal with that. And we'd be happy to help work with you on it. And then the other thing, this is the brand new thing. I was happy to see that the Prevention Magazine folks knew about the particle size. This is the newest of blood tests. We've only had this now within the last year, looking for the size of LDL and knowing full well that although there are about 5 different sizes, the worst one to have an elevation would be the very small LDL. And so if you have genetically an elevated level of your small LDL, you can't do a thing to selectively lower it, but you have to put the fire out that's caused by it. And there certainly is a pretty unique strategy to do so. If you have no idea, and by the way, I can tell you, it happens very frequently. Sort of surprised me when I first saw it, where somebody has a normal cholesterol, they have a normal LDL, and so they're walking around thinking, hey, things are pretty good for them. They're feeling pretty cocky about the whole thing. And then I found when we asked for that particle size that they had a huge disproportionate amount of the small LDL. That puts them in a category of risk that they would have never known about had that not been ordered. So, like a fly on the wall, folks, I'd love to be there when you bring that up to your PCP. Please ask them to get LDL particle size and lipoprotein a, number 4 of the list of 7 tests to be ordered. So says Prevention Magazine. Now, the next one we've talked about many times. I certainly see its implication here. It's talking about your blood sugar levels, and it is not asking for your fasting blood sugar. This one, at least, shows me a bit of sophistication that your fasting blood sugar isn't really what's of interest. Your hemoglobin A1C is, because that's showing us literally a movie of your blood sugar over the preceding 90 days. Whereas one snapshot of your fasting blood sugar could erroneously show you that things are all right. What I find out is that we have, and I've named it to be a new term that I use frequently called, maybe you can remember me saying it before, closet diabetic. This is one that has a completely normal fasting blood sugar, but when we measure the hemoglobin A1C, they're absolutely over the line. They're full-blown diabetic for the rest of the day, other than the first blood sugar in the morning, which is their fasting. So you want to ask your doctor, as I have already told you, to ask for a hemoglobin A1C. Now this next test is a new one. It's a new one on me in terms of something at one time I actually did order this. There was a company that moved to doing DNA detection, genetic tests, and in particular with respect to cardiovascular system. I want to find out if you've got one of 3 gene mutations, something called a K1F6 gene mutation, as well as 2 gene mutations of the APOE system. Now, if you did have an elevation in any one of those mutations, you couldn't do a thing about it per se. I mean, that would be your genetics. But you certainly would be forewarned that you would have to make up your risk by extending your ability to correct problems, because you would show that you absolutely had a higher incidence of cardiovascular disease and heart attack than those that would have a normal K1F6 and APOC gene. Now the final of the 7 tests, which I absolutely see done quite a bit, is the super stress test. This is called a stress echocardiography. It's a test that does a echocardiogram both before and after the stress. It increases the accuracy of the stress test by up to 85%, and it is an indirect way that you can determine if any blockages exist within the coronary vasculature. So, those are your 7. As I look at the list, I say to myself, certainly Dopplers, do them. CRP, absolutely do them. By the way, if you're worried about having a controversy with your own doctor, come on in and see us, because without any controversy at all these blood tests will get ordered, and then some. There's some that weren't even mentioned here. Lipoprotein a, particle size, hemoglobin A1C. But with respect to the cardiac calcium score, which I consider to be invasive, which I consider to have too much exposure to X-ray, and the super stress test, I would rather have done what I believe a year from now, or maybe 2 years from now, the people from Prevention Magazine will write about. You see, I believe that this MSG study that we're now doing is what's going to set the trend for the future and allow us to have, as if the results of the study, as if you had a coronary angiogram without actually having the angiogram. You can literally get the same information from the MSG testing, lying on a bed for 7 minutes, having the computer analyze 166 data points, and have it correlate with a 90% accuracy between what it says you have in the way of occlusion and what actually appears. 90% accurate. That's phenomenal, folks. I think MSG puts out of business the cardiac calcium score. I don't see the need for it. I don't see the need for the super stress test with the dual echocardiogram. I don't see the need, as a screening test for sure, the need for a cardiac cath. I don't see the need for a cardiolite scan. All these are they are able to give us only minor amounts of information compared to this new test, which we started yesterday in my office, called MSG, and now we'll continue to have on the long term. Please take me up on my offer, folks. Give us a call, 724-942-3002. We can arrange to get all the blood testing that you need to meet the points raised by Prevention Magazine, but I'll say there are many other points over and above these that are critically important. But because we do MSG, I think you don't need to do cardiac scanning or cardiac calcium scores, super stress tests, cardiolite scanning, or coronary artery catheterization. I think we're talking about, at least as a screening tool, a thing in the past. As to whether or not, based on the results from this study, you might require them, that's a different matter altogether. But you sit back and you listen to shows like this, and you think, well, geez, I wonder what the status of my coronary arteries are, but I'm sure as heck not going to have a cath done. Who would ever want to have a cath done to find out that information? Hey, we can now find out without any type of intervention of that magnitude. And I hope you take me up on my offer to you to come on in and have that study done. Next time we've done in my office is on the 24th of February. Give us a call, 724-942-3002. There you have it. All right, let's do this. Quick break just to wet my whistle. Coming back in a moment, going to talk about something I've had on the back burner for now 3 weeks, talking about the cost of drugs. I'm going to let you in on, I call this the behind the curtain segment. I'm looking to peel back the curtain and allow the listener to get a look at conventional medicine. Sometimes not pretty at all, but completely honest and completely accurate. I'm going to do so with respect to pharmacies and the exorbitant prices that they charge for the drugs that you get your prescriptions filled for in your local CVS, let's say. Be back in a moment talking about high cost.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in a formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Here on this Dunlap portion of the show, we're coming around that home stretch and still allowing you, if you got a mind to give us a call at 412-825-6262. If I hear a knock on the door, I'll let you in the store and we'll see what's on your mind. With the remaining moments, I have an additional matter that I say has been sitting on the back burner for a couple of weeks. There's a little story behind this I'll share with you. I have been involved for now many months with helping to put together I guess you're going to call it an urgent care center in a municipality very close to the McMurray area. The town is called Canonsburg, and I think many of you know the home of Perry Como and Bobby Vinton and things like that. Anyway, in the course of trying to put together this urgent care center, one of the elements that needed a component of the urgent care center was the pharmaceutical formulary that would have to be kept in-house to be able to treat a host of people that had an urgent issue and that needed to have certain medications. And so I sat with great interest listening to a company. We don't have to get into the name of the company. I just thought it was pretty amazing to hear. They presented me, and I'm reading off of it right now, with a list of the drugs which they said to us, look, we're going to give you a list of the drugs that are available, and we're going to show you how, without a cost to you, doctors, without a cost to the people who open this facility, how that you can earn revenue from keeping on the formulary certain medicines. And we're not going to charge you a thing to do that. All we're going to do is take 30% of the profit and let you stay with 70%. So you got the idea? Well, that was the initial way it was presented. Now, when I looked at the formulary that they presented to me, remember once again, I always, when I see that the curtain is being peeled away and I'm looking at the emperor wearing no clothes, it really grabs me. And so what grabbed me, and I'm going to go down through the list that was presented to us during our conversation with a company who comes to us to give us a way to make additional revenue at this urgent care facility. And it made me a little mad. Here's why. They've got categories of medicines here, and when it comes to NSAIDs, okay, the non-steroidal anti-inflammatory medicines, that's what NSAID stands for. And of course, the oldest one of the list, of which there are many, something like ibuprofen. But ibuprofen is at the bottom of the list because, as I think they're trying to point out to us, you can't make any money off ibuprofen. It's been out too long. So instead, what you may want to do is take this medicine called Mobic, which I had never prescribed anyway. But the reason why you want to do that, doctors, is that the cost to you is going to be $8.33. And then we're going to go bill this for you, and we're going to charge the insurance company $437.48. That one blew my mind. $8.33 is the cost to us, and then the profit, 30% of which would go to the supplier, and the 70% would go to we who work in the facility. But to me, to think that there's a way that through insurances you can play games like this, and in particular, the two kinds of insurance, and they're only interested in these two kinds of insurance, are either workman's comp or automobile insurance. If it has anything to do with any other kind of insurances other than those two, they're not even involved. I mean, they'll allow us to sell the drug and put a cost to us at $8.33, but they're not even going to get involved because they can't make enough money. Only can they make enough if they can bill a workman's comp case. How is it that in the state of Pennsylvania, so hurting as it is, the workers' comp board can allow for such an abuse. This is what made me mad, what made me angry. And so I pass it on to you. Moving down through the list. Is it making you mad? Next group of meds. Next group of meds was gastroprotective meds, and one in particular was Prilosec. Okay? Everybody has heard of Prilosec. And so the company that was sitting across the table from us said, well, you know, look, for 20 milligrams of Prilosec in 30 capsules, the cost to you doctors is $14. We will go ahead and bill this at $264, for which we'll take 30% and let you stay with the 70%. $14. They're going to bill $264. They've made a business over working two types of insurances, automobile and workman's comp. They are interested in not even being involved with any other form of insurance coverage other than those two, because they know that there's going to be a problem in getting that kind of a reimbursement back. It's just obscene. I realized it when I first saw it was obscene. How about this one? Muscle relaxants. There's a drug, I'm very familiar with a drug called Soma. And it comes in 350 milligram tablets. You can get 120 tablets of Soma for $15. You're allowed to bill workman's comp and automobile insurance $523.98. $15 charge to us. The profit margin 70% of the 523 versus their cut. 30% of the 523. Are you getting the picture? Are you getting upset? I have some other ones I could go through. I think I've made my point. I'm glad I finally pulled this out to give you a peek behind the curtain. There's some rotten stuff going on out there, folks. To think that in this state that's so harmed and damaged by being broke, no money, that this game is continually allowed to be played. Anyway, enough said about it. Over here at Super Bowl on Sunday night, how could you forget? I'm hoping to talk about the Super Bowl victory on Monday. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on your health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
KHB reminds you, children are naturally curious.